As an orthopedic spine surgeon, it's critical that I demonstrate to my patients the right way to perform, the right way to stretch, and I emphasize core strengthening. So today we'll go through a few routines that show the best way to maximize your body mechanics in order to optimize your health ultimately.
Dr. Gbolahan Okubadejo, or as his patients refer to him as Dr. Bo, treats conditions involving the lower back and cervical spine. The primary focus of his clinics in Englewood, Clifton, and Jersey City is on the degenerative conditions of the spine, such as disc herniations and nerve impingements. Dr. Bo emphasizes injury prevention by teaching his patients the right way to prevent injury.
The key here is proper form. So now we're demonstrating a good way to begin your routine. So this puts a clear focus on the low back. Most of the problems that I treat involve the low back, and I think a lot of people, as we get older, we tend to get stiffer. And the stiffer you get, whenever you get involved in dynamic activities, we can tend to hurt ourselves. So he's demonstrating a great way to stretch the lower extremity. This stretches out the fascia, which is the layering over the muscle in the lower back. And as that stretches out, it allows a lot more blood flow into the region. Notice the breathing pattern. Now that we're done stretching, now we're ready to get back into action. And now we'll begin an abdominal routine.
Dr. Bo stresses the importance of working out your core. He recommends that everyone works out for a half hour at least 3 times a week, and that includes aerobic activities and muscle exercises. Some of the abdominal workouts he suggests are planks, sit-ups, and the ab wheel.
His discs are getting separated as he goes down. Okay, so this opens up the disc as he goes down, and then as he comes back up, it closes down on the disc. And then when he goes back down and he holds, the stress is in abdominal muscles. So this is a complete routine for the core. And because it's a dynamic exercise where he's constantly moving, it's also an aerobic routine. So I think that's, once you begin strengthening adequately, I think that's probably the best thing you can do. As we get older, I think there's a tendency to ignore these exercises, and that allows the disc to break down. People get disc herniations. And what I treat more than anything else are disc herniations. I've performed multiple, so hundreds of surgeries on herniated discs. If everyone did these exercises routinely, I'd be out of business. So, because there'll be no disc to fix. So, to maximize your health, please strengthen your core as much as you can.
Dr. Bo tries to practice what he preaches. He's typically in the gym working out 4 to 5 times a week, and from his observations, he claims that 60 to 70% of people use bad technique. In his opinion, the best way to get over your bad habits is to fully understand proper body biomechanics.
Let's demonstrate an improper way to lift first. Arching your back forward, rocking as you lift. As you lift more and more, you can imagine that you're going to have a clean jerk, and what that may do is put too much stress in your low back and increase your chance for injury. So proper lifting, you can support your back, make sure you have some bend in the knees, so all the stress goes right into the biceps. Instead of rocking at his torso and rocking at the legs, everything is very well controlled. The stress goes exactly where you want it to go, which is right in the biceps. Because you're not flexing your lower back, you're not putting any stress on your discs at all. All the stress goes right into your biceps.
Most of Dr. Bo's patients are above the age of 35. That's when most weight-related injuries occur because people's bodies just can't do what they used to be able to do, and he emphasizes that to all of his patients.
One of the huge revelations in my practice that I make every single day is that we're not 18 anymore. And everyone's always distressed, everyone's afraid of getting old. Bottom line is we all get old, okay? But we have to make sure we age gracefully, and we have to accept the fact that the body changes as we get older. One of the key changes in the body is that our discs get stiff, okay? As we get older, our discs lose fluid, they get stiff, and the odds of injury are much higher. Certain routines, I think, have to be eliminated after a certain age. Subjectively, you ask me, I think over the age of 35, certain things you should never do anymore, period. Because your odds of injury are just too much, and the risk far outweighs the reward. If you want to herniate your disc as quickly as you can as we get older, is by doing this routine. I think after a certain age, the clean jerk should be eliminated. So there are safe ways to lift, and there are ways that are unsafe. So squatting uncontrollably with a free weight over the age of 35, I don't think is that safe. So I would say one of my biggest frustrations is people lacking a sense that they are getting older, doing things that are dangerous that can lead to back injury. So if you accept that we're getting older, accept that the body changes, and adjust your activities appropriately, your odds of injury will be much lower, making you happier and making me happy as well. Because happy patients mean a happy doctor.